We are going to get started. Hello, thank you all for joining today. My name is Kristen Strom. I serve as President and CEO of Common Sense Institute. For those of you that are not familiar with Common Sense Institute, we are a fiscal policy research institute, and we believe in free enterprise and the protection and promotion of Colorado's jobs, economy, and individual opportunity. Just a few housekeeping items before we get started. We are going to be joined by several speakers today who will all be introduced. We are going to hold all Q&A until the end of the program. If you do have questions throughout the program, please log them in the chat function, or you can wait until the end and just raise your hand and I will facilitate the Q&A. I want to give a special thanks first and foremost to our partners at the University of Colorado Denver and Works Lab. It's been a pleasure to partner with them. They also helped review this first phase of a 3-part research project that we are honored to be joined by them and working with them on the project. Today is really perfect timing for the release of this report. As many of you know who are on the call today, Host actually released their 5-year strategic plan yesterday. And while we haven't had the opportunity to dive into the full 140-page report, we hope that this report can also help provide a baseline of information and facts as they build on that 5-year strategic plan and we move into the second and third phases of our work as well. I would also like to thank all of our community partners. This has been a project over the last several months, and we have been joined by wonderful partners that I just am really thrilled to see come on board. One of those partners, a really special individual, 4th-generation Coloradan who cares deeply about this issue, deeply about Denver, and really was the convener of trying to get this report and this research started. So I would like to now turn it over to Mike Zolner. He was the finance chairman of the Together Denver campaign. He's the past chairman of the Downtown Denver Partnership. And as I mentioned, he's an individual in our community who is really dedicated towards solving this issue. Mike?
Well, thanks very much, Kristen, and good morning, everyone. It's a real privilege to be with you today and releasing this report. I think the history is important here because it's a natural extension of the Together Denver campaign and our promise at that time that we can do better. And as part of that campaign and as part of all the community outreach that we did, we realized, I think, as a committee that there was a lot of misinformation out there surrounding this topic, and that there's an awful lot of there's not a baseline of information and data that we can then build on to say, okay, do we need to spend more money? And if so, where? And are we spending too much in another area and not getting results? And I think it's really a hope of this study that we can develop a baseline that we all as a community can point to and say, yes, that is how much we're spending on this issue. These are the organizations that are committed to making a difference to those people who are living on the street. And here's the number of organizations and people who are part of this process, so that we can then start to break down some of the silos and start to really change outcomes. If we want different outcomes, we have to take different approaches. And it's a hope that will be the next step in this process. But this work is really important to finally have an idea of just how much we spend. I think we were all surprised that it's over $400 million a year, and that we really can do better. We can get more results, and we can definitely have a bigger impact than we are, and that's the goal here. So why don't I turn it over to Dave Davia now, who's going to talk a little bit more about where we are and where we're heading. Dave is a passionate leader, a good friend who has a diverse background in public and private organizations. Dave currently serves as the EVP and CEO of the Mountain Mechanical Contractors Association, and working in multiple states in our region. Dave has a unique background being an elected official and city council person in Westminster, as well as just a passionate community activist, community organizer in our city. So Dave, you want to take it over, please?
Sure thing. Thanks, Mike, and thanks, Kristen. Good morning, everybody, and welcome. Thank you for being here today. This is an extremely important topic for us. It's heartbreaking for me to witness the number of growing tent cities and people experiencing homelessness. Every day I drive and you see a new city being erected, people who have lost their home and have their eyes filled with dwindling hope for a change. As Mike said, we can do better, and I would encourage us that we must do better. I applaud the Common Sense Institute and CU Denver and all of our other partners that you'll get to see here in a moment for taking a stance and taking a look at this very important issue. The study that is being released today is significant. Understanding the depth and breadth of the resources being spent on trying to combat this issue is eye-opening. This is our first step in the process in making a public policy change and challenging us to do so. Personally, I believe homelessness is a symptom and not the cause. Or said differently, people experiencing homelessness did not wake up one day and say, you know what, today I want to become homeless. They've had something in their life happen, something deeply personal, whether it be a loss of a loved one, a divorce, loss of a job, becoming underemployed, a substance abuse or alcohol issue, and it goes on from there. This report is that first step to understand the how, so then we as a community can do better to address the root causes. The same tools and policies we've been engaging in aren't working. The number of people experiencing homelessness continues to grow. I believe that this is a first step in better understanding and fully understanding what's working today and what is not. That starts with a clear understanding of the size and scope of the issue and ultimately the economic footprint, or in other words, what resources we are investing and how they're being spent. There are many astounding facts that you're going to hear today. Consider that we have nearly a 1-to-1 match for the number of people working to solve homelessness as those that are experiencing homelessness. Again, that is a 1-to-1 match. We're spending between 2 to 6 times the amount on an individual experiencing homelessness as we are to educating our K-12 youth in Denver Public Schools. These are the details that are going to get covered today. I'm a 5th-generation Denver native. I'm proud to call Denver home. And this is one of those issues that we simply cannot pass on to our next generation. We have to solve that today, and this is our start. It's my pleasure to introduce to you Brenda Diconer. She has joined the Common Sense Institute as a Mike Loprino Fellow. Some of you may know her and her body of work from the education space, whether that be at the Colorado Department of Higher Ed, whether that be the National State Conference of Legislators. Brenda is a passionate individual who has spent the last number of months rolling up her sleeves and understanding what you're about to see today. I will tell you, I have never met an individual that has such high energy and integrity for what you're about to see. And it's my pleasure to introduce to you Brenda Diconer.
Thank you very much, Dave. I'm going to share a PowerPoint to walk through our key findings. As Kristen mentioned, this is a community partnership between, the project is a partnership between the Common Sense Institute and CU Denver. Common Sense Institute did take the lead on this first phase, but CU Denver's InWorks Innovation Lab provided critical feedback and thought partnership, and they will be taking the lead on the next 2 phases in collaboration with Common Sense Institute. So this first phase is a look at the compilation of the current resources within the system. Following this, we will be engaging with the community. We're already underway in phase 2 and engaging with the community to really understand what factors are working and what is not. And so how can we understand the system and really map that system to make a set of prioritized recommendations? And then ultimately, how do we display this data in a user-friendly dashboard so that the community and stakeholders can have access to this information? In phase 1, which I'll be walking through today, this report, we focused on several different things. First, we included some descriptive data on homelessness in Metro Denver. Then we looked at the various revenue streams that flow into this space, as well as the expenditures. We have a section on the workforce around the number of employees and volunteers, as well as estimates of shelter and housing bed availability. To start off with looking at homelessness in Metro Denver, we look at the point in time count. This is a nightly count conducted annually, or it's an annual count conducted one night in the year. The last full count we have was January 27, 2020. Unfortunately, because of COVID-19, they were not able to count the unhoused individuals. And so we don't have a full complete 2021 count. However, looking at the 2020 count pre-pandemic, we know that there was around 6,104 individuals identified as experiencing homelessness within the 7-county Metro Denver region. The Metro Denver Homelessness Initiative is the continuum of care for the Metro Denver region and helps coordinate this count and release this data. And you can see that within Denver, they have about 68% of individuals experiencing homelessness were located within Denver out of the 7-county region. About half of the individuals who were experiencing homelessness on that one night in January were located in an emergency shelter. About a quarter were unsheltered and another roughly quarter were in transitional housing. And we know from the pandemic that these numbers have increased. Again, we're hoping to get good data and the January point in time count in January 2022. But for now, this is the data that we have. And within the report, there's additional data on the demographics of this population, number of families experiencing homelessness and veterans, as well as different challenges that those who are experiencing homelessness are currently battling, whether substance abuse problem or mental health concern. One of the other areas of the report that we explore are the complexity of the revenue streams in this space. The HUD department, or the U.S. Department of Housing and Urban Development, provides a great deal of funding that flows through cities. It flows through the state of Colorado, it flows straight to the continuum of care in Metro Denver, and ultimately down to a network of providers. This is just a very simple kind of graphic to show the complexity. This is by no means complete. There are other funders and other layers to this in this space, and clearly other cities and counties receiving these funds too, not just City of Denver. But we really just wanted to kind of elucidate the complexity in the network of how funds flow and how they flow between different entities in our state. And in addition to the federal funding, there's local taxpayer dollars, there's state taxpayer dollars, there's philanthropic dollars. And so really trying to disentangle this is quite impossible, and trying to follow these revenue streams is very difficult. So for this project, where we ended up seeing that they flow downstream, most of these dollars do, much of this dollars do, to the network of providers, charitable organizations that are providing the services and the shelters to individuals experiencing homelessness. And so how we estimated expenditures was to look at that network of providers for those that we could collect data on and look at their tax forms and their program service expenditures. We tried to verify numbers with some of the larger organizations in the Metro Denver area, and ultimately then come up with an estimate of what's being spent on homelessness in Metro Denver. That led us to our estimate of $481.2 million being spent annually on shelters, services, and healthcare for people experiencing homelessness in Metro Denver. Of that, a great share is being spent in the City of Denver, about $434.6 million. Again, we know that these are estimates. We believe that this is a conservative estimate. We did not have financial data on the full array of charitable organizations Many religious organizations are not required to report out on their 990 form financial data, so we don't have that. We also know that there were various municipal governments and agencies and entities that we were not able to collect data on. However, we believe that these estimates begin to shed a light on the system-wide resources available to resolving homelessness. And the reason the city and county of Denver share is quite large is for a number of reasons. And we do know that, as I mentioned, that 68% of people experiencing homelessness are within the city of Denver. We were also able to collect data from Denver Health and approximate, and they have a report to the city. This is from their 2020 report to the city that estimates the amount that they spend on charges for patients who are experiencing homelessness. We don't have comparable numbers for other hospitals throughout the state. Private hospitals are not required to report on that. And we reached out to UC Anschutz Health, for example, or UC Health at Anschutz, and they just don't track homelessness as a kind of descriptive data point on their in their healthcare records. So that is also why the Denver number is a little bit bigger than some of the other cities and counties in the region. We know that we're kind of undercounting the overall expenditures in the healthcare arena. But we were able to get numbers from the city of Denver, from their police and fire department. The Homelessness Resolution Fund is the recently passed tax increase. It's estimated to bring in 40 million, not guaranteed to bring in this much, but that is an estimate of the annual income from that tax initiative. And then the charitable organizations located in the city of Denver. We did take the headquarters for the organizations and counted them in Denver if the headquarters were, knowing that some of the services do bleed into other cities and counties. Certainly some of the providers in Denver are providing services in other areas of Denver Metro. So that is how you get to this kind of larger number for city of Denver. But again, the bulk of the services and the bulk of the shelters are within the city of Denver. So we also think that this reflects reality in this space. We did also do a profile on the city of Boulder and then highlighted their recently approved by their city council 2022 budget dedicated to homelessness resolution. Again, not the full extent of what is being spent by the city of Boulder, but again, it gives us an insight into some of the priorities and what cities are currently right now focused on, with the city of Boulder dedicating funds to having an internal team to manage encampment cleanups, extra ambassadors, more park rangers, and more police officers as well. And then we have an estimate for charitable organizations within Boulder. Similarly, we profiled the city of Aurora and found that they spend around $7.8 million annually as their estimate. Again, these are approximations that the city of Aurora was able to give us from their police and fire departments, as well as their housing and community services department. For all, again, I would emphasize that for all three of these city profiles, we are not capturing the full array of spending. Even within Denver, we didn't have numbers from the Department of Public Health and Environment, from their transportation department, or the Human Services Department, which we know all are providing services to people experiencing homelessness. But again, begins to shed a light on those resources that are available. And when we're able to add up those major cities, as well as charitable organizations in other cities and counties in the Metro Denver region, we ultimately get to our estimate of $481 million being spent. We took this estimate, this top line estimate, and we looked at ranges of per person spending. We did this based on two different counts. I discussed the point in time count, which happens one night in a year. There's also an estimated annual count, which stakeholders recommend using as 2.5 times the PIT count. What this gives you is an estimate of individuals who might be experiencing homelessness at least once throughout the period of a full year. And so within that range, we're able to get a better picture of what this per person spending might be in the Denver metro region. So for the city of Denver specifically, for example, we have a range of around $42,000 to $104,000 being spent per person experiencing homelessness. Within the greater Metro Denver region, that figures around $31,500 to $79,000 per person experiencing homelessness. Within the city of Denver, to provide some context around that number, we currently spend about $19,000 per student in the Denver public school system. Average yearly rents around $21,000 per year. Per capita income for an individual in Denver is around $44,800, and the median household income is $68,500. The report does provide a list of the charities that we did pull financial data for. Again, this is not a comprehensive list, but it is Well, we believe a list of a lot of the major providers of care and shelter and housing. We do provide a data appendix so that you can see the actual expenditures for each of these organizations. Along with that data on the expenditures, we do for each of those charitable organizations that I just showed also have data on the workforce in terms of the number of employees and volunteers. We are using a range for this as well. These organizations, many of these providers work in many areas and don't focus solely on individuals experiencing homelessness. So we have a range of what we're estimating it to be 4,000 to 7,000 employees who work on services and housing dedicated specifically to people experiencing homelessness. There's a large, robust volunteer sector. We've estimated a range of around 55,000 to 85,000 people, putting in around 200,000 to 300,000 hours of volunteer time each year, with a financial value of those volunteer hours of $5.7 to $8.6 million per year. And again, to emphasize, we are really looking at those organizations that are specifically serving individuals currently experiencing homelessness. So this report did not include expenditures for affordable housing, low-income housing, for rental assistance, or any efforts to keep people housed. We were really trying to carve out that space to understand what is being the resources that are being dedicated to those individuals currently residing in emergency shelters, transitional housing, or living unhoused. And to that point, to look at the beds available in those different categories, we looked over time and you can see a shift for an increase in permanent supportive housing. We've grown the number of emergency shelter beds. Our transitional housing and rapid rehousing programs have shrunk a bit over the last 10 years. And this is something we'll dive into more in phase 2 as we think about the policies behind this and what is working or what isn't working, and then really the priorities that we've shifted to over the years. And so we'll get into that in the second report. In terms of bed occupancy rates, again, this is from the 2020 data from the point in time count. So it isn't, it is a little dated, but it is what we have at this time from the point in time count around the number of beds that were available and the number of occupants that were in those beds on that night. There were beds available in both transitional housing and emergency shelters. And then we have data from the city of Denver that is more recent from last year. So we're able to see during the pandemic that the city of Denver put great effort into expanding the capacity of beds through hotel rooms, through pop-up shelters, and able to really serve those individuals that were struggling to find a home during a critical, a very difficult time in our lifetime during the pandemic. And so at this point, from the data, we know that we were able to meet that demand. City of Denver was able to meet the demand, increased demand in the number of individuals experiencing homelessness who needed emergency shelter beds. So that was our phase 1 findings. There is a great deal more in the report. Those are the high level findings. We encourage you to check out the full report on our website or in the link that was dropped into the chat box. In our next steps, we're really looking forward to taking this baseline of data. We do believe that these estimates are not, they're never going to be perfect given the complexity of this space, but we believe that these are good, solid estimates that begin to shed a light on the resources available to solving homelessness. And with this baseline of data and this baseline of facts, we can then turn to look at programs that are working, that are not working, where are we allocating our resources, and where can we double down on what's working to invest more so we're getting greater results. And I think everyone on this call wants to improve outcomes for our unhoused neighbors. And we're really excited to dig into that next phase of research to understand how we can better do that. So I am going to turn it over to Dan Greiner from the University of Colorado, Denver to talk a little bit more about our next steps.
Thank you, Brenda, and good morning, everyone. Very happy to be partnered with CSI and working on this project, and a lot of great data is being pulled, and we're learning a great deal about this space. For myself and my team working in the research side, over the past 3 months, we've reached out to over 100 different governmental organizations, providers of services, people formerly and currently experiencing homelessness. We were able to interview a large cross-section of those groups and have some preliminary data that we were using to build a systems map of the homelessness ecosystem. This map will really help us to inform how individuals move through this system or not, and highlights some of the critical barriers for entry, the pitfalls that are frankly experienced by some of these individuals. This map will also be calling attention to relationships that exist between stakeholders in the system and what dependencies exist in those spaces. So from all this work, we really hope to highlight key leverage points that will aid us in creating better policy, expertise, and resources so that we're able to really do exponential good in this space. That's our phase 2 effort, really the qualitative and the research portion. We hope to output this in a more digestible way in our phase 3 work, where this will involve combining the data and the great work that Brenda and her team has been working on, presenting those together with the insights that we've gathered and putting them into a data dashboard. Through this, we'll be able to show some of the dynamic impacts that might be able to be gained through informed engagement with that system. This will be publicly accessible and, of course, represent our best understanding of the space and the information that we've gathered from our stakeholders. I do have one ask. If there are groups here who we have not had the opportunity, or groups that might hear this, that have not had the opportunity of speaking with us yet, we would really love to reflect your voice and your work in this process. So if you haven't spoken to us or one of our researchers, please contact us through CSI or CU Denver InWorks. We would love to hear what you have to say and make sure it gets into this critical space.
Thank you, Dan. At this time, we will open it up to questions. If you have a question, please unmute. Looks like we'll actually start with Alexander Burness. Does this money include per capita government spending on costs for all things not related to homelessness for people living here? Parks, snow plowing, fire department, etc. I'm also curious whether you have any estimate for how much money municipal government spends annually on the people who are housed. I'm thinking spending on some of that stuff I've listed above. Brenda, do you want to take a stab at that question?
Yeah, thank you for that question. This really focused more on the direct services towards people experiencing homelessness. So when we reached out to City of Denver and Aurora and Boulder, really tried to look at those police and fire numbers represent their dedicated staff who they have working on their homeless outreach team, as opposed to kind of the sort of more indirect services. We do try to estimate, some of them, you saw Boulder was estimating their park rangers, that again, those park rangers that are specifically dedicated or mostly dedicated towards serving people experiencing homelessness. We don't have at this point, in this project, we did not undertake trying to estimate kind of more of those indirect expenses, or as mentioned, even the kind of wraparound for preventing people and to entering homelessness. We did not undertake that for this report.
Okay, another question. How exactly do we quantify positive outcomes? And Dan, Brenda, maybe you two could tag team how you're looking at some of the positive outcomes.
Yeah, I'm happy to speak to some of that. So different groups are charting those in different ways. We're really trying to understand, and that is one of our key questions that we do ask. How are you charting outcomes? How do you celebrate success in this space? And we're seeing a lot of differences in that space. They don't all have one unified definition of what success looks like. And because there are so many different types of people who are experiencing homelessness, success looks different for different people. So I can't really speak to the entire space of how they would do that in a great way. But if you have a specific area or a group that we would talk to that would help to illuminate that, I'd love to hear more, and I'd love to have a better answer for you there. But like I said, it is so differentiated between the groups.
Dan, do you want to drop your email as well in the chat?
Certainly.
Another question related to stimulus funding. Did this report look at COVID dollars spent or stimulus funding? Is that included in the total? Brenda?
Yes, great question. And I did not mention this in the in the numbers that I gave. We looked primarily at fiscal year 2020, which does go for many of these charitable organizations through a good portion of 2020 and likely captured some of the CARES Act dollars that flowed. However, it definitely does not capture the American Rescue Plan Act funding that was sent to states and municipalities. And we know that there were, good chunks of that were being put towards homelessness, that there was around $29.4 million allocated to the Home Investment Partnerships Program to help those experiencing or recovering from homelessness, as well as even state dollars with Colorado under its Colorado Rescue Plan has put about $15 million to purchasing hotel rooms for unhoused individuals. And then there's a great deal more towards the affordable housing bucket as well that's going, coming from those stimulus funds.
And Brenda, you have all of that outlined in the detail of the report as well, correct?
Correct. You can find some of those details in the report. Yes.
One other question. How do you believe the public defines a positive outcome regarding homelessness? Dan, perhaps you want to touch on this? You've done a lot of stakeholder outreach.
It's similar to the previous question in the fact that it's hard to gauge exactly what these outputs, the positive outputs would be. So within this space, there are so many different types of people experiencing homelessness. If it's chronic homelessness, that might be engaging in programs that help them to get mental health assistance, job creation assistance, maybe drug treatment, some of those types of things. Maybe it would be helping them transition into a house. If it's the geriatric homeless community, right? Finding a way to get them into a sustainable living situation that allows them to find a house. People in domestic violence challenges. So really, in our stage 2 work and in our stage 3 work, we really have to define it differently for different groups. And I unfortunately don't have a better answer than that.
Thanks. And Dan, I agree with what Dan has said. I would say too, from kind of my perspective of this research, that overall, we're looking to see that all people are stably housed and self-sufficient. So how can we promote that path to self-sufficiency, and how can we do it in a way that ensures they remain stably housed?
Another question, do we have any comparison to what other cities outside of Colorado spend on a total or per capita basis on people experiencing homelessness?
I do not have a comparison number for other cities. I'm not aware of how or what kind of research other cities have undertaken on this. I do think it was a difficult endeavor to try to piece together all of this data and these expenditures. I'm not quite sure if others have tried to do it.
One other question, and this really touches on the phase 2 work, which is still underway. So for those of you that are asking about phase 2, you'll have to stay tuned for our release of phase 2, which I think I mentioned, but I'll mention again, we anticipate releasing phase 2, phase 3 of this work late September, early fall of this year. So here's the question. What are some of the programs that work? Dan, I know you're exploring this right now. What are some programs that don't work as well? Can you answer that yet, or are you still underway on that?
Well, we're finding different things work for, again, this is that differentiated challenge. Different things work for different people. And there's no one size fits all solution in this space. So some of the things that, we've heard and seen other cities undertake when it comes to housing first and things like that. People use some of these terms ubiquitously, but really it's a photo finish with other types of programs, right? Housing first must be accompanied by a lot of other types of programs. And we're seeing how some of those approaches really require a coordinated effort between many groups to see success. So we're not seeing any bad actors, I'll say that. We see a lot of people who are engaged and are really trying to do good in this space. And they're all adding to that big piece of the pie in different ways. So I think everyone has their hearts in the right place and is trying to provide value along that continuum of care. So like I said, we really do hope to provide more as we talk to more people, as we learn more, we'll be able to speak more to that. And There are strategies that are a little more risky or a little bit more on the edge, right? They're experimental in some ways, and we'll talk to those as well. What are some of those preliminary results? What are some of the things they're doing that might be different and might be more effective or less?
Thank you, Dan. So all of you stay tuned for phase 2 release as well later this year. Could you give a more detailed breakdown of what the $481 million goes to? Housing, police interaction, specific services. I'd love to have some detail on where that money is going. Did you actually do the flow downward too, Brenda, or was that not part of this project?
Yeah, I think that the list of charitable organizations included in our data appendix, the report, would be helpful for the person making that, asking that question. I think that there's a wide variety of services and shelters provided. I think predominantly we are, housing is, shelters are a great portion of that expense, that operating emergency shelters, transitional housing, case management as well. The kind of human-centered programming is obviously going to be expensive, right? So the kind of having case managers, having mental health counselors, having certainly the police and the fire departments that have dedicated staff towards the homeless outreach teams. All of those were included in these costs, as well as any type of other wraparound services for individuals experiencing homelessness. So whether that's food provision or healthcare, any of those kinds of services and wraparound support provided to those people currently experiencing homelessness. But definitely encourage you to check out that data appendix.
And that is the very end of the report. So I encourage you to visit commonsenseinstituteco.org and download the full report. A question related to that, where is the $40 million of tax increase dollars in Denver being spent?
That's a very good question. I don't have that answer readily available. I can try to see if I can find that through some of the City of Denver reports.
Mike, do you want to answer? Jump in.
I think the question is around Colorado Concern. Is that correct? And if you visit their website, I think that is a board that's controlled or appointed by the mayor's office and city council that is issuing grants. They issued 94 grants last year and had approximately $10 million that was unallocated of those funds. But it's a wide range of funding, and a large number of organizations that aren't listed in this report necessarily, but that have received grants from that board.
I think are you talking about the Caring for Denver tax initiative?
Caring for Denver, I'm sorry, yeah, thanks. Brenda.
That is a different tax initiative focused on mental health. The $40 million for the Homelessness Resolution Fund is in the City of Denver strategic plan. I just dropped that into the chat box, so they have details on how they propose to spend those funds.
One other question. We mentioned some of the homeless population having lost their homes. Do we have any statistics about what proportion of the homeless population is homeless because they've been evicted, failed to make rent, or their home is foreclosed? Were there any data points on that, Brenda?
Not in this report, but I'm sure they live somewhere, and happy to try to look into that and get back to you.
Great. I am through all of the questions in the chat box. Are there any additional questions from the press? Seeing none, we want to really thank you all for joining us this morning. We encourage you to visit the full report on our website, commonsenseinstituteco.org. If you would like a full recording of today's press conference, please email me directly at kristen@csinstituteco.org, and we will make sure to get you that, and also the PowerPoint. And then lastly, I want to thank all of our great community partners, especially CU Denver. Mike, Dave, thank you so much for your instrumental leadership. And then especially Brenda for her amazing work on this project. It's been a large labor of love, but it's wonderful to start to see some sort of facts and data around this important issue and really supporting our neighbors. So thank you so much for joining us.